since we don't really know what specifically causes it. Another way to manage it is to prevent it from happening in the first place, those attacks. Today we're going to talk about adult onset asthma. Now, I know some of you think that asthma is a childhood disease and that once you're out of your teenage or preteen years, you're done. But there is such a thing as adult onset asthma. Now, this type of asthma typically manifests in adulthood, generally after the age of 20. Now, this is completely different from childhood asthma, which usually occurs during early childhood. The exact cause of adult onset asthma is not really being fully understood by medical professionals, but it is strongly believed to be caused by a combination of genetics and environmental causes. Some common triggers for adult onset asthma include things like respiratory infections, allergies, and exposure to irritants and pollution. Some symptoms for this type of asthma typically includes wheezing, coughing, chest tightness, and shortness of breath. The treatment typically involves just medications, mainly to control the symptoms, since we don't really know what specifically causes it. Another way to manage it is to prevent it from happening in the first place, those attacks. And you should also identify what your triggers for these attacks are and try to minimize or completely avoid them when possible. It is very important for adults who are experiencing asthma symptoms. Now, if this is your first attack, it is advisable that you see your doctor so you can be properly diagnosed and well managed. The treatment plan for adult onset asthma often includes a combination of medications and often lifestyle changes to help manage your symptoms and prevent attacks. Here are a few common components for a treatment plan. This is what it could look like. Medications, allergy management. You need to come up with an action plan for asthma. It is important for individuals who are suffering from adult onset asthma to work very closely with their healthcare provider to develop a personalized treatment plan that meets their specific needs and helps them to effectively manage their asthma symptoms. Regular follow-up appointments and monitoring of your asthma symptoms are also very important to ensure that the plan you have developed is working as planned, that the plan is working effectively. Adult onset asthma does not have to be a deal breaker or ruin your life or completely change your life. You can make certain tweaks to your lifestyle and keep up with your medications and know your triggers. That is so important, to know what triggers it. Is it stress? Is it a certain type of day? Is it dust? Is it pollen in the air? I don't have any specific issues with pollen and things like that, but my husband is very allergic to the smell of grass. Fresh cut grass, he cannot take it. So he's sneezing and he's just very uncomfortable. So what are you uncomfortable with? What stresses out your system? So what can you not stand? So figure that out and avoid it at all costs. That way you don't have to worry about having so many outbreaks of symptoms. My name is Ngozi RBK Okafor. Progress is coming.